Hello and welcome. Today we're diving deep into a rare and often challenging neurological condition affecting the eyes, chronic relapsing inflammatory optic neuropathy, or CRION. Join us as we explore what CRIO is, how it affects vision, and the latest in diagnosis and management. The exact cause of CRIO remains elusive, making it a subject of ongoing research. Unlike some optic neuropathies directly linked to infections or specific autoimmune disorders, CRION typically presents without a clear, identifiable trigger. Scientists believe it involves a complex interplay of the immune system mistakenly attacking the optic nerve, leading to inflammation and damage. Genetic predisposition may also play a role, but more research is needed to fully understand the underlying mechanisms. CRION's pathophysiology centers around inflammation and demyelination of the optic nerve. The optic nerve is like a cable that carries visual information from the eye to the brain. In CRIO, inflammatory cells infiltrate this nerve, disrupting the myelin sheath, the protective coating around nerve fibers. This demyelination impairs the transmission of signals, leading to vision loss. The relapsing nature of CRION suggests the immune system's attack is intermittent, with periods of inflammation followed by remission, but subsequent relapses can cause further damage. CRIO is considered a rare disease. Precise prevalence and incidence rates are not well established, primarily because it is often misdiagnosed or underdiagnosed due to overlapping features with other optic neuropathies. It can affect individuals of any age, gender, or ethnicity, but more research is needed to identify potential risk factors and understand its true epidemiological profile. The signs and symptoms of CRIO primarily involve visual disturbances. These can include a gradual or sudden decrease in visual acuity, often affecting one eye at a time, but it can also affect both eyes. Other common symptoms include eye pain, particularly with eye movement, color vision abnormalities, making colors appear washed out or dull, visual field defects, such as blind spots or peripheral vision loss, and sometimes abnormal pupillary responses. The relapsing, remitting nature means these symptoms can worsen, improve, and then worsen again over time. Diagnosing CRIO is a complex process involving a thorough neurological and ophthalmological examination. Doctors often use a combination of tools, including visual acuity tests to measure sharpness of vision, visual field testing to assess the extent of peripheral vision, and color vision testing. Optical coherence tomography, or OCT, helps to visualize the optic nerve and retinal nerve fiber layer. Magnetic resonance imaging, or MRI, is crucial to rule out other conditions and to look for inflammation or lesions along the optic nerve. Furthermore, blood tests are performed to exclude other autoimmune disorders or infections. A defining characteristic for CRION diagnosis is a positive response to immunosuppressive therapy. Diagnostic criteria often include relapsing optic neuritis, exclusion of other causes, and improvement with steroids or other immunosuppressants. CRIO doesn't typically fall into distinct subtypes, but rather it's defined by its clinical course, the chronic, relapsing, and inflammatory nature of the optic neuropathy. The severity and frequency of relapses can vary between individuals, impacting the overall management strategy. Treatment for CRION focuses on managing the inflammation and preventing further damage to the optic nerve. High-dose corticosteroids, such as intravenous methylprednisolone, are often the first-line treatment during acute relapses. Long-term management typically involves immunosuppressive medications such as athioprine, methotrexate, mycophenolate mofetil, or rituximab to suppress the immune system and reduce the frequency and severity of relapses. Regular monitoring is crucial to assess the effectiveness of treatment and to manage potential side effects of the medications. Visual rehabilitation, including low vision aids and strategies, can help patients adapt to vision loss. Currently, there are no proven methods to prevent CRION, as the underlying cause remains unknown. Early diagnosis and prompt treatment are crucial to minimize optic nerve damage and preserve vision. Individuals with a history of optic neuritis or autoimmune disorders should be vigilant about any new or worsening visual symptoms and seek prompt medical attention. The prognosis for CRIO can vary. While treatment can effectively manage symptoms and reduce the frequency of relapses, some patients may experience permanent vision loss over time, especially if treatment is delayed or ineffective. Recent research focuses on identifying biomarkers that can predict disease activity and treatment response, as well as developing more targeted therapies with fewer side effects. Clinical trials are ongoing to evaluate the efficacy of novel immunosuppressive agents and neuroprotective strategies to improve long-term outcomes for patients with CRION. Gene therapy is also being explored as a promising future treatment option. Continuous research offers hope for better understanding and management of this challenging condition.